So what attracted me to the Spin New to Practice Fellowship program was that it was doing an additional day alongside my normal practice nurse role, working with a GP fellow, which was quite exciting because it's not something that practice nurses would do typically in their day-to-day practice. One of the reasons I decided to do this was that it was with a GP fellow, so it was really great because we had the chance to bounce ideas off each other. We were there for each other for support, learn from one another, and in general we just made a really good team. The other thing was that we had a really good mentor, so whenever we were sort of stuck in the project, we could ask someone for support and for advice. However, the most important reason I would say is the fact that, you know, we had the chance to improve care for patients at home. So I would recommend the New to Practice fellowship program to recently qualified GPs and general practice nurses because it's actually quite humbling that the small project that my colleague and I started together has sort of developed and is still being continued this year as well. And it's actually immensely rewarding when we get positive feedback from patients, which we often do. And I feel like we're bringing good quality of care to patients at home. I think what surprised me the most is that when we were in the beginning phase of developing the project, I didn't realize how many other healthcare professionals there are that are so willing and helpful to help develop your project, which is really great. It really helped my colleague and I when we were doing our project. I think it would be to make a good and clear plan for your project, ensure it's realistic time-wise as well, and that there's someone there for support and for guidance, that you have a good mentor. This project has really helped me to develop as a practice nurse. I feel I am more equipped with knowledge of resources and, for example, referrals that I can make to help patients a lot better. It's certainly helped in my day-to-day interaction with patients as well. It's also helped me to become a more autonomous and confident practice nurse.